My name is Liz Serrier, and I'm the Assistant Director of Engagement at the Institute for Health Metrics and Evaluation. I'd like to take the opportunity to extend a very warm welcome to each of you. Thank you so much for joining us for this session. Today we have the honor of having Ms. Katherine Leach-Kemon and Dr. Nsikan Akpan as our presenters. So please allow me to tell you a little about each of them before we dive into our proceedings. So Dr. Nsikan Akpan is the managing editor for Think Global Health at the Council on Foreign Relations. His previous experience includes roles at New York Public Radio, National Geographic, PBS NewsHour. His work has received a George Foster Peabody Award, a News and Documentary Emmy Award, and a AAA S. Kavli Science Journalism Award. Dr. Akpan holds a doctorate in pathobiology and molecular medicine from Columbia University and a certificate in science communication from the University of California, Santa Cruz. So please join me in extending a very warm welcome to Dr. Akpan. He's also joined by Ms. Katherine Leach-Kemon, who's a senior content strategist at the Institute for Health Metrics and Evaluation at the University of Washington. In this role, Katie works to bridge the gap between academic research and policy. And to this end, she designs communication strategies to engage decision makers and oversees the production of reports, infographics, and policy briefs. Her work has been published in The Lancet, Health Affairs, the Journal of the American Medical Association, and she earned an MA in Public Health at the University of Washington and a BA in History from the College of William and Mary. She previously also worked as a postgraduate fellow at IHME, studying development assistance for health. And so before I hand the floor over to Katie, I'd just like to take a few minutes to review our agenda quickly and to go over some housekeeping. So in today's session, we'll spend approximately 35 minutes just exploring our collective efforts to reach policymakers through commentaries and briefings, as well as outlining the process of submitting, pitching, and writing pieces with Think Global Health, an online bulletin that is read widely by global health decision makers. Following the presentation, we'll have a 15-minute question and answer segment where each of you will have the opportunity to pose any question that you may have. And so again, out of necessity, our mics are muted. And so if you'd like to ask a question today, please do so using the Q&A function. I'd also just like to share that we will be sharing the recordings on our Collaborator portal, so you will have access to those after today's session. And so without further ado, once again, thank you all for joining us, and I will hand the floor over to Katie.
Thank you very much, Dr. Serrier. I will now share my slides. Thank you all so much for coming today. It's really an honor to talk to you, and just thank you for all of your collective efforts to help us do this important research that I'm going to be talking about today. So I'm going to speak about some of our efforts to reach policymakers and different forms of content that we've used to reach them here at IHME. So first, I'm going to talk about some global burden of disease briefings that we've put together. And then I'm going to talk about how we've used commentaries to try to reach broad audiences. And when I say broad audiences, I mean folks who wouldn't normally read scientific papers, policymakers, general audiences, advocacy organizations. So first, the global burden of disease briefings that we prepared for the latest update of GBD 2023. You can find them on our website at healthdata.org/GBD. And we have prepared a series of infographics, briefings, policy briefings that detail the high-level findings from the study. Here you'll see an example of what the cover of the infographic booklet looks like. And inside you'll find these one page front and back briefings that we prepared. We prepared one for each major paper that was associated with the GBD, each major capstone paper, as we call them. And this is an example of how you can see where we prepared an infographic for the demographics and mortality study. And so what we do is, as you know, there's so many findings from each of these papers. It's really hard to choose just a few to present. But we've highlighted the main findings and some of the interesting takeaways that we think journalists and policymakers might find compelling. And we've also talked about what's new, because a lot of people ask us every year when we update this study, they say, what has changed between this GBD study and the last one that you did? So we try to highlight that, new data, new methods, any kind of big improvements that you all and our researchers here at IHME have made together. And this is a chart, just as an example. You can explore all the infographics online. But this is an example of a compelling chart that we put together showing how emphasizing one of the main messages from the study, which was that we've seen this huge drop in life expectancy in all the regions during COVID, unfortunately, but we've also seen this big rebound since the COVID pandemic was declared over. And another nice thing about this is we've seen this chart go viral, as they say. We've seen a lot of people sharing it on social media. Our social media people here at IHME have shared it. We've seen a lot of interest in this, even in this one chart. And there's lots more that you'll find in the infographics. Why create these? Why create these one-page briefings? So the reason that we found these one-page briefings so helpful is that if you're meeting with someone, you're going into their office, you can physically print it out and just put it on the table. And it's a really nice entry point for them. Whereas if you hand them a very dense scientific paper, they might be a bit overwhelmed, especially if they don't have an academic background. So this is a way to give people an overview of your most important findings. And then also it helps prevent them from being overwhelmed, as I show you in this chart that I really like, where a person is being overwhelmed with data. It's less is more when you're presenting to policymakers and general audiences, I find. And you can also, the beauty of these briefings is that you can tailor them based on who your audience is. If you're talking to somebody from a specific region or country, you can tweak it so that it just shows those findings from that country. If you're talking to somebody who works in a specific disease area, you can focus in deeply on those disease-specific findings, et cetera. And you also can see how online, a lot of people have shared the charts from these graphics, which are easier to understand than a lot of the charts that are in the scientific publication. So you need, I think my main message is you need both. You need that scientific publication that is published in a reputable journal and has been thoroughly peer reviewed and has that scientific stamp of credibility, but you also need this easy to digest short summary of your main findings that you want to get across. Now, another thing that we've done is we've used commentaries to reach a broader audience. And a very effective strategy that we've had for doing this is our collaboration with Think Global Health. And I'm so glad that Nsikan will be here today to tell you more about it. We've had a longstanding collaboration with Think Global Health since the year 2020. And right as the pandemic started, we've done a lot of work together. We've seen a variety of different stakeholders contributing to the site, and it has earned millions and millions of viewers. It's seen great success. So congratulations to you, Nsikan, and your colleagues for all of your hard work. This is an example of how we've had interviews. We've benefited from interviews with Think Global Health editors who have talked to our experts here at IHME about their research. So this is one study that we recently released back this summer about the state of global health funding, financing global health, it's called. And Alison Krugman who wrote this piece and interviewed our experts. She did a really nice chart showing very clearly how global health funding has sharply declined, largely driven by the cuts from my country, the United States, unfortunately. And we saw a lot of traction. We saw this piece picked up by major newspapers like L'Express in France. And we saw even a prominent former policymaker, George Bush Center. We saw his center pick it up, link to it. And we've also had faculty and staff from IHME and our collaborators also contributing to Think Global Health. This is one example of a collaboration from our faculty and staff. They wrote a piece that dove deep into the benefits of cycling, but also the hazards based on the global burden of disease findings. And it talked specifically about the Netherlands and how a lot of folks there have this amazing cycling infrastructure, but at the same time, people aren't really wearing helmets. So as people have adopted e-bikes, which go really fast, they've seen more deaths. So it was a really nice piece that got picked up by various news sites and also by some government websites. So Nsikan, I will hand it over to you to talk to our collaborators about the process of writing for Think Global Health. Thank you so much.
I should unmute myself and I will share my presentation. Great. Great. And you can see just the slides? I assume you can't see my notes too?
Hey, Nsikan, we can see your
Oh, you can see the notes as well.
your next slide. We're seeing your presenter's view.
Okay,
There you go.
sorry.
Perfect.
Okay. A little trickier. Okay. In that case, one second. One second. Let me see if I can just. Sorry, hold on. I'm going to open a second window so I can see my notes. Sorry about that. Sorry, hold on one second. I'm going to open up a second window so I can have my notes separately. Okay. All right, great. So you can just see the slides now, right?
Yes, perfect. Thank you.
Okay. And you can still see it even if you can still see it now?
Yes, we can.
Perfect. Great. Awesome. Right. So yeah, my presentation, I'm going to talk about Think Global Health and the collaboration that we've had between CFR and IHME. My presentation will be broken down into three basic parts. So we're going to talk about Think Global Health, what it is and who we are. We're going to talk about a couple different strategies that we take and the impacts that they've had. And then I'll talk about next steps. So as Katie mentioned, Think Global Health launched in January 2020, not very long after the first cases of COVID-19, but the idea was originally conceived in 2019. From its inception, Think Global Health has been a collaboration between the Council on Foreign Relations and IHME. We think we really value the idea of speaking policy to the people, finding ways to translate these policy reports into matter that a general audience can appreciate. And we have, we have a lot of core philosophies, but I would say two that really stick out to me and that I think are important for fellows to know is that, first we're this online bulletin, and we like to think about the ways that the ways that changes in health are reshaping economies, societies, and the everyday lives of people around the globe. And the mission is really to provide a compelling forum for examining where and why global health matters and to engage readers in debates and efforts that improve health worldwide. And a compelling forum is really something to clue in on. It speaks to sort of the foundational principles of the council itself, which was started to recruit experts from around the world and also in the United States to develop foreign policy. So in terms of our team makeup, there's the founding editor, Tom Boyke. He is CFR's Bloomberg Chair in Global Health. He's the director of the Global Health Program here at the Council, and he's also a senior fellow for International Economics, Law, and Development. I am the managing editor, but I also sort of focus on certain beats in terms of the projects that I take on for editorial work and also for when I write. And so those topics are infectious disease and vaccines based off of my background as a researcher, or my former life as a researcher before I became a journalist. I also focus on population decline in age-related disorders and neurodegenerative disease because of some research from that past life. We have Allison Krugman, who is our associate editor for Data Visuals. She focuses on climate and health. You've probably seen some of her articles on global aid funding, which, we leaned heavily on IHME this year, given all the changes with global aid funding and the beautiful work that they were doing to track those changes worldwide. And we've published a couple of updates on that. And then Allison also focuses on global conflict and Gaza. Caroline Cantus is our associate editor. She's the longest serving member of Think Global Health. Her beats include global health governance and foreign aid, especially in Africa and Asia. Alejandra Martinez is our research associate. She serves sort of as our editorial assistant. So she edits pieces, but also helps maintain things like social media and some of our partnerships. Her beats are healthcare for young adults, mental health, and migration. And Katie is a contributing editor from her seat at IHME. Okay, so if you attended Tom's previous presentation to the IHME Fellows, you'll remember his discussion of Think Global Health Strategy or founding principles. And so, global health faces expansive, interconnected, and evolving challenges. The sectors affected by global health remain siloed in some ways in disparate fields and niche policy and academic circles. The field often operates reactively, sometimes, mobilizing around epidemics or emergencies. So, the idea within global health is trying to tackle some of those challenges, namely, first by addressing communication gaps. So, much of the work in global health is inspiring and innovative, right? The things that you do not only affect people's lives, but, I think there's a real passion that comes from being a researcher in one of these fields. And so, part of what Think Global Health tries to do is get that passion into the story, so that way readers will connect with the story, and then want to read about, okay, so what's going on with the findings in your technical reports. We think, in terms of communication gaps, there's also a need to engage other communities and non-US audiences, and doing so is essential to broadening and understanding participation. And progress in global health depends on collaboration across disciplines and domains, from health research to economics to diplomacy to media. There needs to be a global view. There needs to be a view on global health as an investment, not just as a humanitarian act. Um, Okay, so how do those guiding principles manifest into strategies for the website? So first, if you look at our composition of authors and looking first at academic authors, that's the first bin of authors that we normally rely on. So as I said at the top, we're trying to assemble a compelling forum of these researchers to really be able to discuss these ideas. Like, we're trying to provide a platform. Or if you think about Foreign Affairs magazine, if you've ever read it, this has been how they've operated for decades, right? Really trying to find the brightest minds, but also the people who are on the ground level of what's going on, and then bringing those voices into the magazine. In terms of researchers, Think Global Health is committed to featuring and publishing contributors from lower middle income countries and covering issues in global health that have been neglected in the past. And we offer an honorarium to the lead contributor if they're from a lower middle income country. Okay. In terms of our second bin of authors, so journalists, we try to recruit journalists from across the globe and lean on sort of areas where we see strong readership. We've really, over the past couple of years, tried to build readership in those areas, and I'll show some data on that. We also lean on IHME expertise. As Katie mentioned, the example on screen is a story that involved a journalist who wrote about the previous iteration of the GBE study. Okay, so looking at impact. So since its launch, looking at impact just in terms of, the authors and contributors and journalists we've been able to recruit to write for us. Since its launch in January 2020, Think Global Health has published about 1,300 articles from about 1,200 unique authors, hailing from roughly 110 nations around the world. CFR fellows and staff provide roughly 15% of TGH's content. So, the remaining 85% of authors are mostly contributors, and a couple dozen journalists, but they're from outside of the council. And the majority of our authors are based outside of the United States, 54%. In terms of the top 10 list of countries where our authors hail from, excluding the United States, it's the United Kingdom, India, Canada, Switzerland, Nigeria, Kenya, Mexico, South Africa, Australia, and the Philippines. So a really nice broad mix of countries. Okay, so the next thing I want to talk about in terms of TJ's strategy is our storytelling style. So, we publish mainly two different types of articles, Q&As or question and answers, which people will understand that format. But the other format that people may not be as familiar with is narrative storytelling. So narrative storytelling takes the shape of something you'd find in a news article or a feature article in a magazine like The New Yorker. It's really about trying to tell the human story that's behind or in front of the research that's in your policy paper or in your study. Or the people who are behind or in front of the numbers, of the data that you found or the trends that you found. And so the example that I provide here is an article by IHME fellows, Louisa Ewald, Kate Legrand, Ali Muqdad, and Gregory Roth. And the reason I show this example is because I really love the writing at the top of the article. So the topic for this article was that this group had introduced a new method for measuring health effects of community-based food programs, and a new method for measuring the health impacts of community-based food programs and farmers markets. And they had some preliminary results, but the report was mostly about the method. And so, the first thing that we think of as editors is, okay, how do we hook the reader to a story that's going to be mostly about method, but maybe not presenting results that could apply, or like data that could apply to like their day-to-day lives. But the method, I think, is, valuable enough to cover because this can tell them about the impact that these food resources have on their communities. And so, the story came out in October, it was harvest season. And so it's okay, it's harvest season. Okay, let's paint the scene of being at one of these farmers markets, and just like talk about what you experienced like as you as you were doing this field survey. And so, it opens with, on a sunny day in Clearwater, Florida, and sort of takes us through what it was like to be there on the first three paragraphs, but then it pivots in that fourth paragraph to, okay, now let's tell you about like why we were there, this method that we've developed for sort of assessing the community impact of these programs. And then next, Next, I want to take everybody into a time machine, and we'll go back to one of my first journalism classes. And I want to talk about the inverted pyramid style. So the inverted pyramid is a structure that we use for organizing the early parts of an article, really the whole article, but especially like the introduction of an article. And so the inverted pyramid is a style that news stories present all the time. They present information in a descending order of importance. So, the thing that you find most exciting, you try to put at the top of the article, and then you go down from there. So maybe after you put that exciting thing at the top, maybe you'll have a little bit of background, and then a little bit about what you did, and then maybe a little more background. But you really just try to hook the reader at the top um, with the facts that they really need to understand or to like get plugged into the issue. Um, uh, the nice thing about the inverted pyramid is that it helps audiences decide whether to continue reading. Audiences are constantly uh, there's a ton of things that audiences can pay attention to, right? Kim Kardashian videos, NBA games, CNN, science stories, right? And so you're competing against all those things. And so what you really want to think is that, okay, what can I tell to a reader at the top of an article to keep them hooked so that way they don't go on to those other things? I think the other nice thing about the inverted pyramid is that, if you can cut from the bottom of a piece. So say your article is running long without losing too much essential information because you've put all that essential information at the top. The style was developed over a century ago, and we use it all the time in newsrooms. Um, I like to say that it's also good to have a little bit of flexibility with the inverted pyramid because it can feel a little unnatural sometimes to shoehorn a lot of essential info into the top. Also, maybe it doesn't work for a story. So, it can be good, say in the case of the last nutrition piece, to lead with characters or to lead with a scene or a place. Or lead with a current event. Say you have some insight into what's happened in Jamaica with Hurricane Melissa, right? Like it'd be okay to lead with some of those details about, okay, here's what happened to these people, and then go into, okay, based off of reports that we've run on Jamaica's healthcare, like here's what we can tell you about the resources that are needed. Um, okay, so that was a lot. I hope you enjoyed my journalism class. Okay, so then in terms of impact, and I think in terms of recognizing how the narrative storytelling style can pay off, Think Global Health, we've accumulated 8 million page views since the launch. But since my time here, so the past couple of years, when we've implemented some of these things like narrative storytelling, the inverted pyramid, we've seen this growth in readership. So, this year we're on pace to double the page views that we saw last year, and it's only October. Um, and we've also seen tremendous growth in the newsletter, which I'll show in a second. But just in terms of the past 2 years, Think Global Health has recorded 3.8 million views and 2.1, there's a typo there, 2.1 million visitors during this period. And in terms of breakdown by country, the United States is the largest readership, but if you look at other countries that read us, India, Pakistan, Bangladesh, United Kingdom, Canada, the Philippines, Indonesia, Australia, Germany, France and Algeria, Cambodia, Nepal, and China, we have really strong readership there. In fact, if you combine the readership from India and Pakistan, it actually is more than what we see in the United States. And a lot of that readership we've seen, especially in South Asia, has come over the last couple of years. Okay. Okay, and then I wanted to talk a little bit about the strategy we have around classic versus new forms of media. And so obviously we have our website, which has existed for it's sort of like a classic storytelling device, right? You might now sort of lump it in with examples like television, examples like radio. Um, but people are moving more towards what they are described as new media or alternative media. So podcasts, newsletters. I think the value of those mediums is that podcasts and newsletters is that there's more of a subscriber-based feel or more of like I'm building a community around a product. And so, we've spent a lot of time over the past couple of years really focusing on like how do we build our newsletter audience. We've had ad campaigns that have driven people instead of to the homepage to this newsletter sign up page, which actually has an archive of every newsletter that we've ever published, and you can read it sort of as like you would read an article. Um, and by doing that, we've had tremendous growth in our newsletter. So we were actually the fastest growing newsletter out of about a dozen at the council this year. And we are the largest newsletter in the studies part of the council, so the think tank. Um, and then in terms of other forms of media that we're working on, we're trying to experiment more in the video space, especially the vertical video space. And so, well, this is a video that one of our research associates and one of our fellows did about a treatment for malaria. Okay, and then in terms of next steps, we want to continue coverage of landmark reports such as the GBD. We always welcome new pitches. We do have sort of a plan or a proposal to connect fellows potentially with local writers to produce joint articles, but that's very much in its initial stages. And I want to acknowledge the whole Think Global Health team, the CFR editorial team, because they help us out with videos, and Bloomberg for sponsoring this. And that's it.
Okay, thank you so much, Dr. Akpan and Katie, for those really insightful presentations and the information that you shared. So we've had quite a few questions come in, and so I think we'll turn over to that segment now. Let me share a couple of those questions for both of you, I think. Question one is there any specific criteria for writing and publishing briefs and commentaries? And I'll just throw that out to, both of you. If say our collaborators would like to write a commentary or brief on, I imagine, GBD or anything, global health around the world, is there any criteria that they would need to do so?
You want to go first, Dr. Akpan?
Sure. I mean, I'll kick off Nsikan. I think in terms of our material, yeah, there's no limit. I think it's more about being able to package the idea. It's helpful to have a news hook or like a current event if there's something like a new policy change or a new proposal by a government. It's helpful to have something in the news, but we can shape most ideas into an article.
Great, thank you. Katie, do you want to add anything to that or?
We haven't had a formalized system in place for collaborators to create briefs, but we welcome you all to create your own briefs based on the needs of your stakeholders, because we are not there in the country where you live. We don't know the policy landscape. You do. You are the expert on your context. So I think the main criteria, if I were to say something, would be when you're creating a policy brief, think about your most important message that you want to get across. Don't try to overwhelm people with information. Make it user friendly, make it something that someone with no background in the subject could understand, and try to limit yourself to one page front and back in terms of the brief. That's what I would recommend.
Awesome. Thank you both for that. And we have another question that sort of builds on this one, which asks, what are some key ethical or communication considerations that we should keep in mind to ensure accuracy and responsible dissemination? So I'm going to throw it out again so either of you could answer.
I can say that we have a very robust fact-checking process. So when I'm developing these infographics in these briefings, I'm starting from the point of reading the paper, or papers in this case for the GBD, and I look at what are the main findings that the authors have highlighted, which are the ones that are most likely to be of interest to my audience. And then I go and I select which things to highlight. And then I run a first draft by the research team, the lead research team, to make sure that it's scientifically sound. I'm not presenting anything that's misleading or inaccurate. And then once I have produced the final version, we have someone fact check it to make sure there's no errors, that it's completely correct. Hopefully that helps.
Great. Thank you, Katie. Dr. Akpan, would you like to add anything to that, or was it pretty comprehensive?
I think that was pretty comprehensive. I mean, I think in terms of communication considerations for social media, keep things concise, mm, sort of follow that inverted pyramid. It's good to get the essential info early, giving you a
Yeah.
very confined space.
Right. Thank you both for that. We have lots of interest in actually creating these policy briefs and how to write for policy. So this other question is, I think, a really clear one that I think both of you would have a good response to. And so the collaborator asks, is it necessary to criticize the existing policy to recommend a new policy brief? I see head shaking, so feel free to elaborate on that.
Dr. Akpan, would you like to go ahead? You look like you have.
No, I mean, I think, you know, research is like, I feel like the foundations of the scientific method and research um, are the weight of evidence, right? And so you can't really ignore what's come before to move forward. And I don't think you need to be, it's okay to be critical. It's okay to be, provide like constructive criticism, past policy, but you don't, we don't always need to throw, I'm going to use an idiom. You don't need to always throw the baby out with the bathwater every time you write a new report. You don't need to take a completely new path, a new tactic. I mean, I do think it's valuable to analyze past policy. Um, but I don't know, I think just in general, there's a lot of negativity in the world, and it's okay to criticize politely while still advancing like a new narrative or a new path.
Great, thank you for that. I like the you don't have to throw the baby out with the bathwater. I think that is something that we can all visualize and will stick in our heads. Katie, would you like to add anything to that?
I think that was very well said, Nsikan. I don't speak for IHME as a whole here, but I think it's a very tricky situation, especially here where we're based in the United States. We have a very challenging situation right now with a big backlash against science in our country, and it's a struggle. I'm not gonna lie. It's very hard when there's a bunch of misinformation circulating, and we're trying to do the best we can to be impartial and be a resource to all political parties, and to try not to get enmeshed in the political fray, but to try to be a voice of science and really connecting with our mission, which is everyone living long lives in full health. And that's what we come back to. And no matter if we're speaking to somebody who may not like our information about vaccines because they disagree with it, we're trying to figure out how do we message them about something they might be more interested, which might be chronic disease. How can we find common ground on that topic? So I think it's really, when there's these political tensions, it's really important as a scientific body to be very careful and to be very diplomatic and to try to maintain impartiality as best you can in a very challenging circumstance.
Great. Thank you so much for that, Katie. I think that added a lot of depth and clarity to the question. And I'm sure a lot of the other collaborators appreciate it. Nsikan, I have a question for you directly from one of our collaborators. And it's directly related to the readership that you showed of Think Global Health. And so this collaborator says, many of your articles focus on global health issues in Africa. Yet no African countries appear among your top readership. Have you considered adjusting your engagement strategies to better reach and resonate with African audiences?
Yeah, I mean, Algeria is is fairly high up there, but I take that point. I think yes, it is something that we've considered. Was the advertising campaign, we can target certain countries, and so that might be something that we do in the future. Some of the trends are based off of internet penetration, and so I actually think that high value for Algeria is because they actually have a fairly high internet penetration, relatively speaking. But it's definitely something that we think about. We try to cover. We want more articles about Latin America. We want more articles about Asia, especially Southeast Asia. To some degree, we get a lot of pitches about Africa. I would say of all the continents, maybe um, besides North America, is probably I mean, actually, I would say we get more pitches about topics related to Africa than we do. Um, Even domestic pitches. And so part of that, I think part of the skewing of the amount of articles towards Africa is that. And then I think part of the audience is internet penetration, and also just like we need to design a campaign that can better target those folks so that way they can see our articles.
Okay, great. Thank you so much for that. And I think also just relating on that, on just the great interest there is in Think Global Health. So this collaborator asks whether you host any conferences or symposia or any in-person gatherings for sharing interesting stories or findings or just pitches and resources.
We do. The council, one of the first activities the council ever took part in was holding roundtables, and something that continues to this day. And so many of those roundtables are hybrid, and so you can access them online. Um, if somebody wants to follow up, you feel free to share my email. I can send the link to the website where you can see the schedule for the events that are open to the public. People can also apply to become either term members or full members of the council, and that's a great way to attend our events. A lot of our roundtables, or a fair number of our roundtables, are closed door, which also speaks to the history of the council, because the idea is that you're able to go to a place and speak freely. But yeah, if somebody wants to follow up, I can send a link to those events. We actually have a roundtable tomorrow, because if people go to our website now, we launched a new tracker for vaccine preventable diseases, sort of fueled by, or it is fueled by alerts from ProMed Mail, which some folks will know. And so it gives real-time updates of outbreaks on a weekly basis, and also presents some historical data from the WHO. And we're going to have a launch event tomorrow for that.
Great. Thank you for that, Nsikan. I think you answered lots of other questions that were posed in the Q&A, basically asking how can we get involved, how can we get information about submitting articles, etc. But we will absolutely, when we share the recording as well as your contact information, etc., on the Collaborator portal, so that information will be there for them. Katie, did you want to add something?
I just wanted to say part of my goal in this doing this webinar was to, and that's Nsikan, sorry, I'm helping answer your question that was directed to you. But we need people from all over the world writing pieces for Think Global Health. And this is one of, the great benefits of collaborating with you all is you are experts in your context. You know the research, you know the setting. I live here in Seattle. I don't know what it's like. I see the data, but you all have the stories, you have the in-depth knowledge. So I think my main message to you is please submit, please write, please. We want to hear from you. We want your voices reflected. Thank you.
Awesome. Thanks, Katie, for jumping in and just highlighting that teamwork makes the dream work. And I think in line with that, one of the other questions that we have is how can partnerships between researchers and policymakers be strengthened to improve the uptake of evidence? And I will throw that out to both of you. So
Partnerships between researchers and who else? Sorry.
researchers and policymakers. You're muted, Dr.
No,
Akpan.
I wasn't answering it. I was like chin scratching. Um, yeah, it's hard. It's hard to say. I'm sorry, I'm just thinking of like the domestic situation that we have in the United States. Um, I don't know. I mean, Katie, I mean, you described the conference that you went to recently, and it sounded like, that was kind of like the perfect space where it was essentially a conference of like do you want to talk about it? It was like health
Sure.
policy, like county officials who were like all got together.
Sure. I had the great opportunity to attend a professional organization conference here in the United States that was specifically a professional organization for state health policymakers called the National Association of State Health Policymakers. And it's the annual gathering for people working in all the states. And something that struck me is just how much, even in what seems like a very divided political climate here in the United States, how everyone was there who was working for the same common cause, and they had way more in common than they did in terms of differences. And that was really reassuring to me. And I think in terms of developing partnerships, it's really important to understand your audience and understand the challenges they're facing on a day-to-day basis, because they could be very different from what you're seeing on your day-to-day basis when you're doing your research. And it's really about merging their interests with your findings and where do those fit together. And also, I think just building relationships, offering to be a resource to people so that they know that they can call you up if they have questions about something you are an expert in, and really developing that trusted relationship.
Yeah, and I think in terms of policymakers, I mean, if you're talking about agencies, I mean, I feel like they do have sort of a constant stream of communication with researchers. If we're talking about politicians, um, I think it's trickier, I think politicians across the spectrum, I think reach out to our team for insights. Um, but maybe what they present the public doesn't always follow those insights. So, I mean, I think if you really want to reach policymakers, you go through the people. You try to appear on radio programs, you try to appear on local TV, you work with you work with like the media teams at your institute, at your university, wherever you're working, to pitch your stories to those journalists so that way they can interview, and that way you can get more appreciation of your work. Because here's the thing, like a politician might ignore you when you say like, hey, like this thing that's happening over here is poisoning your water, but I gotta tell you, the public will not ignore that. And so if you can, yeah, find like these radio programs, these news programs, you really work with like every university has like a media office. So, if you work with those people, they can find ways to get you into the community. And then the politicians, I tell you, will listen to the community because they have to.
Great. Thank you both for those responses. Also, just building on this, on the idea of just communication and expanding, that and having it more sustained between researchers and policymakers. Our next question, what tools or formats, so be it briefs, infographics, dashboards, or, radio shows, have any stood out as being most effective for translating evidence into actionable policy and promoting uptake?
Katie, you want to go? Right.
Sure. For us, I
Yeah.
think briefings have been very effective because when you have those one-page front and back briefings and you bring them into a physical meeting or you send them via email, it provides an entry point. So people say, oh, that's interesting. I want to know more. And then you start a conversation and it piques people's interest.
Great.
I think data visuals, if we're talking about digital environments, so, websites, social media, they can be really helpful for, everyone can understand a map. And everyone I think is sort of like attracted to maps. They're like, oh, look at this place that's like lighting up over here. And so that can be a good way into a story. Um, I think in terms of different mediums, the medium that's growing the fastest is social video. So YouTube, um, Instagram Reels, TikTok, but you have to be sort of a specialist to um, or have like a clear idea or a clear way of performing your research to the public in order to develop audiences there. You're almost better off maybe reaching out to, there are a lot of like science and health based people on those platforms, and like if you tell them a good idea, they might feature it there. Or if you enjoy using those platforms, like it doesn't hurt to just try. But I think there has to be a little bit of passion and desire around wanting to use those platforms because they are very specific, and it is very awkward to just like hold a phone up to your face and take and do like 10 different takes before you post something. So I wouldn't just like hop in unless you feel like a desire, a passion to do that. I try not to tell everybody, like I try not to say that like anybody um, can have success on any platform, because it's just not true. There are just like certain platforms that people will gravitate to in terms of their skill sets.
Okay, great. Thanks, both of you. So I think maybe to just put all of that in a nutshell, what I'm hearing is passion for your topic, whatever it is you want to share, sustained communication in a very attention-grabbing, interesting way, and having, public support behind you are all ways that work to getting just evidence into actionable insights and uptake. Nsikan, we have another question for you, really
Sure.
clear, that somebody asked, does Think Global Health publish articles in other languages? And if not, have they considered doing so?
I believe we have published a handful of articles in Spanish, but yeah, it's definitely something that we've considered. It is when I was at New York Public Radio, we published a few pieces in both English and Spanish, especially ones that involved reporting in Spanish-leaning neighborhoods. It's really valuable. I think the other valuable thing in that regard is going to understanding like the cultural dynamics for different social media platforms. So, for instance, like Telegram is really popular for some communities. WhatsApp is really popular for some communities. And so, if you're trying to reach people in those communities, going through Telegram or going through WhatsApp might be more successful than say going through like a Facebook or an Instagram.
Okay.
But yeah, you're right. I would wish we could publish in every single language, but and if we ever did, it would probably be in our biggest audiences. So
Okay, great. Thank you for that answer. And I think just on the heels of the modes, the methods of communication there, the languages, etc. This question is, how can you prioritize, or how do you prioritize which pieces of evidence to highlight when, time and attention from policymakers is quite limited. So how do you go about doing that? Both of you?
I would
Yeah, I don't
say
know. Yeah, sorry.
I would say it's a challenge because there's, as you know, there's infinite number of stories in the GBD that we could tell with the data, and it's not a perfect science, but in the work that I've done over the past 15 years in this area, I've I've done, it depends on the product. If it's the GBD infographics, the main goal here is to summarize the findings in a quick way. And so I have heavily weighted the main findings that the authors have shared. If I'm going into a politician's office and I know they care a lot about, say, opioid deaths because it's a really big problem in the United States, I will veer towards presenting the findings that we have on that specific subject that they are interested in, and then try to find a way to present a few more pieces of information that I think are important, but may not necessarily be high on their priority list. So it's a balance, and it's also, there's no right answer. I would say you learn as you go.
Yeah, it goes back to that inverted pyramid idea, which I do, which works well for grants and uh, research papers. So, if say you're writing a grant, you're most likely going to lead with some of your strongest data, some of your strongest findings. And so I try to, I would try to get in that mentality, get in that mindset of like, okay, here are the findings that we think are the strongest or the ones that we think impact the most people. And then, the findings where you're like, oh, we have something preliminary, but we don't quite know what it means yet. You can sort of save for later. And those can actually be really good for describing like where the story goes next. And that's often like a good way to end a piece, or end like, whatever type of storytelling that you're trying to do. But I typically tell people like, yeah, get in the mindset of writing a grant and how you might lead with like your strongest piece of evidence.
Okay, great. Thank you both for that. We have 1 minute left. So I think in that 1 minute, one last question, Nsikan, this one's for you. Does Think Global Health accept briefs and commentaries related to GBD only or any
Oh yeah.
other findings?
Any findings. Yeah, I presented a couple of examples from GBD, but truly like any finding, and like we have a lot of other examples that are non-GBD. I presented like I think maybe three or four that are GBD related.
Right. Right. Thank you for that. And having said that, though, I would just like to encourage, everybody who's attending our audience that we have the newly released GBD 2023. So absolutely, there's lots of great information, and evidence in there, which can be used, for policy briefs, commentaries. So while they accept from everywhere else, it is new and breaking. So good source to write on. And with that, I would like to say, first of all, thank you to Dr. Akpan and thank you to Katie for the presentation this morning. Thank you also to our audience for, giving up your time and spending some of it here with us today. We do look forward to your continued interaction with IHME, with the GBD, and with Think Global Health. And so with that, we again will post the recording and we'll have the opportunity for you to reach out and ask any questions that we may have not gotten to in this session. So have a great rest of the day wherever you might be in the world, and thank you so much.